Hi, I'm Dr. Johnny. Thanks for joining me today. In keeping with our How to Create Beauty segments that we've been doing, today I'm going to look at Lady Gaga. We're going to look at her face, at the changes over the years, and I'm going to talk about fillers, what can be done, what may have been done. I have no idea exactly what has been done, but I followed her over time a little bit because I'm just taken back by her sheer level of talent. What she can do, how she can compose songs, music, her acting. It seems like she can do it all. When she sits down at the piano is where I'm most mesmerized. She plays so many instruments. All that seems like some people just get it all. So let's look at her face. We do these for education purposes. Again, I don't know exactly what she's done, but when you're in the spotlight, you're on every magazine, people are watching your face over time. They want to know what they can do. If they have similar faces, if they don't, what did she create? How did she create it? And that's what we're going to look at, angles and lines and folds. And I did a podcast with Bree. Go back and watch it. We talked about social media, TikTok, Instagram, the drivers to aesthetics now and why younger and younger people are doing it. So if you don't like aesthetics or you don't want to partake in these options, you don't have to watch the video, but if you're intrigued at what they do, what it looks like, what may have been done, how it applies to you, at the end of the video, we're going to look at her today and I'm going to say, what would I do? What would you do now going forward, given how she looks? She walks in, what might be a few recommendations we might make to her? So stay tuned here. Let's pop into the video and watch Lady Gaga and see what we think in 3 seconds. Okay, so if we look at an earlier picture, I want you to pay close attention to the cheek volume. Look at the lips. We know she did say she had lip fillers, I think on the Howard Stern show or somewhere. So we know lip fillers may play a role. Nice wide opened eye. Notice the shape of the eye. She's looking differently in this picture, as I'm going to show you another comparison, but some people have talked about maybe a medial canthoplegia. I don't believe so. And then I'll remove all the markings here and look and pay attention to the nose. So this gives you an idea. And we're going to look at the next comparison picture just to see what we think may or may not have happened in a few areas, including the nose. So if we look here, we can see still a rounded cheek. We have volume here, still in keeping with a rounded cheek. Now keep in mind, over time, the bone changes. What happens? The eye the socket gets bigger, it rotates down. A lot of times the face gets narrower, and certainly hormones and there are different facets, but fat pads in the face change. And this anterior cheek, remnants are of it here, but looks to be a slightly more higher cheek. There's some hair covering there. When we covered it in talking with Bella Hadid's video, on that video, a lot of people in talking with them from the channel said, hey, the narrower face, kind of like Gaga has over here on your right, made her look older. And certainly adding fillers in the front when there's fat and nice light projection gives that heart-shaped face. It gives a warm feeling, whereas you get more of a colder feeling here. And I covered that in the cheek video. Here you can see those changes. Lip filler, if you think about it, certainly the lower lip might be the telltale sign. Look at the lower lip here, it's fuller. If you look at the vermilion border up on the upper lip here, it certainly has that somewhat filler look, but I think very well done and subtle, not sausagey. Notice that they kept the shape. And when we talk about lip fillers, look at the Cupid's bow. Particularly these 2 dots of the GK point here. The GK point, I'll remove those markings, is where the philtrum columns meet the lip here. And we're looking on this picture on the right. And that's very important. And there's a central tubercle here. That was not addressed or filled to any great extent. And I like the lower lip curling down. The lower lip has 2 fat pads, 1 on either side. It does not have a central one. I like that. So that's kept it very natural looking. Look at one thing. The mouth is turning up here. That can be done with neuromodulators at the depressor anguli oris, which is a triangular muscle here. And also she's smiling, of course, so that plays a role here. Let's go over to the next picture and take a little look. Now, like I said, she has talked about getting fillers at different points and stages of time. Here, there seems to be more volume despite aging. Okay, we know she had volume over here, more youthful picture when she was a little younger. But here, her face has really changed. One might even say puffy or too full. And you look at the smile here, the smile's a little unnatural looking. One thing we haven't talked about a lot is dentition, okay, and how many teeth should show with a smile, should lower teeth show or not. It certainly seems like there's some lip filler here that she's admitted to, but I wanted you to look at the upper lip here. The upper lip, as opposed to the last picture, looks a little more unnatural. And if you look, I'll remove the markings in a moment, you can see here and here what appear to be bumps of filler. Very normal after filler. You see again, see what might be lumps of filler here. Very normal to have those. Why? Because, and here you do not see them. Of course, this was a while ago on the left. But it's normal to get lumps after filler because look at this wide smile, okay? If you draw a line down from the mid-pupil, or one might say, I call it the mid-pupil, but some people would say the white of the eye, the inner white of the eye, where the white meets the colored part of the eye, that should give you the width of the mouth. She's pretty perfect when you draw that line down, but the point of it is, when you smile and you get that wide smile, you're stretching lip, of course you're going to see some filler. It's somewhat impossible not to. So we say that. If we look at the nose, if anything has been done, and we'll look at a lateral view in a minute, I think it was fairly excellent because you just can't tell, not much was done. I would point more to something in the chin if I'm thinking about it and you're thinking that something was definitely done, because we'll look at a lateral view in a minute. They didn't take much of the hump off, and fillers could be done to get what she had. People talk about blindness in the nose area, and a lot of people want to talk about it, and this area is commonly filled in Asia. A lot of the cases we know are from there. And a lot of the data, it's hard to know what the exact number is, but certainly the number one risk area is the glabella, because people try and get rid of the frown lines, and then the nose, then the under eyes, because the angular artery comes up along the nose. But what is the risk? When people often talk about 1 in 10,000, maybe. No one really knows. Maybe 1 in 100,000. And you got to quantify that. And so what risk would someone else accept? The risk of a fatal car accident, this number seems so high to me. In the United States, 1 in 100. Digest that for a minute. So when people ask me, hey, is it risky? Can I do the nose? What are you comparing it to? Risk of electrocution, somewhere around 1 in 12,000. Okay, and if we say blindness from fillers is 1 in 10,000, well, you know the relative risk then is small. The reason is when it happens, it's a devastating event. So when we talk about what is the risk of fillers, understanding what you can accept for your risk. Let's go back and look, however. So nose fillers definitely are done. I want to look at the side profile because I find this interesting. Look at the jawline here, very nice. Look at the lips, well projected. Botox injection points, okay? Botox or other neuromodulators. A lot of people like, of course, Dysport works well, okay? I like that. A lot of my patients like that. So you can see those injection points. Those alone likely won't produce that amount of lip flip. Remember the initial video we saw? She was much younger, but now has a more defined border. Now we'd want to see her whistling. To fully notice, you need to see dynamics. At the end of the video, I'm going to tell you 2 factors that we're not looking at here that are necessary to know, but I would say certainly fillers at the border. Now, if we talk about noses, everyone wants to know the nose. Certainly it's upturned here, it looks good, but there's still that dorsal hump. If someone was to do surgery, a lot of times they're going to want to get rid of that, okay? And I still see that here. If something was done, it was subtle and it was good. But instead of getting rid of it, in some pictures I see it, some I don't, she is a good candidate for fillers, or as you see me do from the tip of the nose, PCL threads. PCL work very good in the nose, work very well. The average number of threads, a lot of people are going to ask me the average number. If you go to Asia, I'd say the average number would be 10. They don't like to do more than 10 to 14. You can certainly start with 3, depends what you're trying to accomplish, but threads can be used. That's not that common in this country, depends where someone goes. Much more commonly would be to add filler at the nasal area. I'm not telling people to do that. I find the risk in America, because every country will have a certain risk and people have a certain risk tolerance, is too high for many people, but she's a good candidate for it. Why? Look at her chin. When I do lip filler, as I talk in all my videos, I'm making you look at the lip and the edge of the mouth before I even will talk to you about lip fillers. Look at her rickets line or AE line, okay? You can study that. You want to look at that. In this, of course, she's not 90 degrees. It's hard to get a star. Hard to get earlier pictures, really good early pictures. It's hard to get full 90 degrees. And of course, to assess anyone, we need 5 views, and at the end of the video I'm going to tell you what else we're missing here. But you can see here, looks pretty good. The chin looks to be maybe augmented. Now, what could you use down here? Chin implants, of course, are great. Fillers, if you use a filler, watch my chin filler videos and chin filler disaster. You gotta watch for the vessels, particularly coming up through the chin. They also supply the palate. Not a good thing, meaning the bottom of the mouth. So you have to be careful of those. But with a stronger chin, and her jawline could be fillers as well. Here's her gonial angle that we often talk about. She has a nice projection of the lip and the lower lip. Her nose is her most prominent feature, but it's got to be balanced with the chin. So I wonder about that. Let's look at one more picture. Okay, I like this picture because this one over here is a recent one. And when we look at that picture, again, I look at the chin, looks real good. The lips, certainly we talked about filler. The nose looks straight here. Now it's not a 90 degree, of course, but it looks good. If something was done, again, it was subtle. I think most important for her, because of the facial shape and her nose being the most prominent, was something done along the chin, and her jawline looks stronger. There are pictures where you can see where she doesn't have a very strong submental area. Things, if you're doing things non-surgical, things like Kybella can be done. You can remove fat with liposuction, works really well. So you have options. Just putting a chin implant alone can make the submentum look better. And if we look again, the volume on this side looks much nicer than the volumization on her right. She just looks like volumes are in the more appropriate places and not overdone, because many people would be tempted to add a high model-like cheek. And what's one of the reasons you might not do that? She has some temporal hollowing here. Now we're really picking this gorgeous girl apart, but imagine if we added cheek volume here. It's really going to increase the size of her face, but more importantly, you add that cheek volume, you're now creating more of an illusion of a more hollow temple, a more hollow preauricular area, and as we discussed, an aging look. If you look over here on the left, this is nice and confluent, not too high. It fits with the temple, it fits with the preauricular, a nice jawline, nice chin projection, gorgeous lips, perfect smile with her upper teeth showing, her eyes look great, and going against the cat eye, of course, she has that downward tail of the brow. Now, if you want to do something with your brows alone and not get the PDO threads that we put on this channel, a lot of people would take the edge of that brow off at the tail and point it upward. Just by doing that can make someone look like they have a cat, fox eye, or PDO threads. Or you could do both if you really want to jack it up at the tail of the brow, play with that, and put 2 threads, maybe even a 3rd one for her. Now, what do you do at this point? If she comes in, what would you be telling her? First of all, the 2 things that we're not talking about that's crucial to know in beauty. Everyone on here is asking me, what do I do? Can I send you pictures of my face? If you send 5 perfect views straight on, 45, 90. Watch my podcast with Bree where I talk about it. I have an idea. What are the 2 things I'm missing? Number 1, facial expression. Motor movement, smile, frown, big smile, little smile. That's why we saw the lip filler in one of those pictures, likely. Okay, what else are we missing? What am I doing right now? Gesturing. So movement, how someone moves, their character, their little flaws, and their gestures, how those 2 points go together make and create beauty. Personality, way important, so important, but we all know that because we talk about it so much. I'm taking that out of it here. But I gotta see movement, you gotta see gestures, you gotta see. You ever see someone and they're gorgeous and you see them walk and it detracts? How people move, how they carry themselves, how they walk, how they hold themselves, all play a role in beauty. But take that aside, just take the pictures we have to work with. What does she do to maintain? Okay? Almost nothing. I love her look. Everything was done subtly if it was done. The nose gives her character if she didn't change the hump. But you could add a little bit of filler. No problem. We got that. She just needs to maintain Retin-A's, vitamin C's. If you're doing something with Plasma Sculpt, great. You'd want to see her smile, the dynamics. If you're starting to see fine lines, you don't want to do something like Plasma Glow or microneedling and PRF. A single dose of Plasma Sculpt. She looks so good, a single dose. Most people would purchase 2 because it saves them. Most people need 2. She's someone you'd look at 6 months and you might not do it because you don't want to overdo perfection. You don't want to change perfection, but you do know, I'm not even sure how old she is, take someone at 30, 35, 40, you're going to start seeing it, get it before it starts, and you're going to watch. It's not something that you do twice and then you see. You could overdo. She looks that good. So all she needs to do is preventive skincare. A lot of people fall on the floor when they hear what the price tag of skincare is. When you're talking about maybe a few IPLs, maybe microneedling, maybe a peel, people who are famous do this all the time. They might come in and do a treatment every month, a skincare type of treatment. That wouldn't be out of keeping $1,000 a month to maintain, not change the look, but maintain. That's roughly what it costs. That's what people do. People who have the money seem to be able to get it done, and that's what keeps them up running to an older age, because as you see, 40, 45, 50, the roles, the opportunities, even well before that, diminish. So maintaining the skin, I wouldn't change a thing. What do you think? You like these videos? Click like, subscribe, stay tuned, and stay preventive to keep your skin and body beautiful, healthy, and vibrant.